Good afternoon, everyone. Welcome to Let's Talk About Resilience, supporting the mental health of youth and young adults in foster care. If you would please take a moment to introduce yourself in the chat box and let us know where you are joining us from, that would be great. This event is being brought to you by the Substance Abuse and Mental Health Services Administration's New England Mental Health Technology Transfer Center, or MHTTC. The New England MHTTC is led by Yale's Program for Recovery and Community Health in partnership with C4 Innovations and the Harvard University Department of Psychiatry. I'm so pleased to be here with you today. I am Sandra Gasca Gonzalez, and I have the honor of moderating today's conversation. And we have three incredible panelists with us today, and I'll introduce them in just a minute. But before I do, I want to let you know that today's event will run for 1 hour, and it is being recorded. All of the participant microphones will be muted so that we can minimize the background noise, but we really do want to hear from you throughout the hour. So please use the chat box to share your questions and your comments. And when you're in that chat box, make sure you set it to all panelists and attendees as opposed to all panelists so that everybody will be able to see what you choose to share. Our team will be grabbing questions from the chat box to discuss as we go. And if you are experiencing any kind of difficulties, technical difficulties, please let us know in the chat and our team will respond as quickly as they can. We want to make sure you have a good experience. So I am very pleased to introduce our panelists today. First, we have Jay Canas, who is currently a senior administrative analyst with the Los Angeles County Department of Mental Health. Hi, Jay. And the UCLA Public Partnership for Wellbeing. And as a former youth under the supervision of the Los Angeles County Department of Children and Family Services, Jay's lived experience inspires him to transform systems of care. He works to co-create innovative strategies that improve the well-being of systems involving children, youth, and families. So welcome, Jay. We also have Amani Myers, who is a native of Boston, Massachusetts, who began her life as a ward of the state, and her childhood experiences in foster care really drive her commitment to help others realize their potential and to break the cycles of generational poverty. Amani previously worked with the United States Children's Bureau as a child welfare policy consultant, as well as an intern in the office of the US Senator Chuck Grassley, and as a White House intern for the Domestic Policy Council's Office of Urban Affairs, Justice, and Opportunity. So that is Amani. Welcome, Amani. And last, but definitely not least, is Catherine Tavares, also known as Kat. We will be calling her Kat today, who is a licensed clinical social worker with over 15 years of experience in human services, including community engagement, systems advocacy, program development, and administrative leadership. Kat is currently the manager of program development and youth transition services at Adoption Rhode Island, which is the state's adoption exchange. And she is a lifelong Rhode Islander, where she currently lives with her husband and 3 children. So welcome, Kat, and everyone else. It's so good to be here with all of you. So I wanted to just get moving right away into the conversation. So we'll just dive right in. I wanted to start by setting a little bit of context for the audience here so that they know the direction that we'll be heading with resilience. And I wanted to start with equity and what equity means and how it's playing out in terms of resilience. And one of the things I wanted to share is that we know that children of color are disproportionately represented in foster care systems. And currently, if you look at the statistics, more than half, it's actually 53% of all Black children and their parents will experience a child abuse or neglect investigation before the child's 18th birthday. Think about that, 53%. In addition to that, Black and American Indian Alaska Native children are disproportionately represented at all stages of the child welfare system. And once in foster care, children of color experience much higher rates of placement disruptions, longer times to permanency, and way more frequent reentry than their white counterparts. And yet, the most common allegation among their cases is neglect, which is inextricably linked to poverty. I know that's a lot to take in, but I wanted to start off with that context so that everyone could understand what we're talking about. But what can you all share about the resilience of Black, Indigenous, people of color in foster care?
Yeah, so I can start. I just want to say thank you, Sandra, for that wonderful introduction. And I'm just really excited to be here. But, as you talk about resilience, and I think about people of color and Indigenous people, I think about our longstanding community of people who've had to survive really negative and disruptive impacts that have impacted the communities, have impacted generations, and have impacted families. And so I think back to my own lineage of people who have endured over 400 years of slavery, as well as oppression and systematic injustices and policies. As a young person who grew up, I was born in a product of the crack epidemic. And so my family, uh, who all went through that experience, had all suffered through that. And so I was impacted by that. And because of that impact, I grew up with a great aunt who was from South Carolina and who, worked in the fields of cotton and all sorts of things. And I remember that one of the things that she often instilled in me was the importance of leadership, the importance of never giving up, and the importance of being determined despite the experiences that I went through. And so I'm not saying that every experience that I experienced was positive, but I had the determination with me from a very young age to make sure that I did exactly what was there for me. And I will say that one of the things that I really struggled through was growing up with both a mother and father who were both involved with drugs and criminal activity. And I remember hearing the message very young to never end up like your mother and father, whether that be from family members, whether that be from system involved leaders or social workers. I was always under the guise of you have to do better. And I would say that in some ways that was a very determining impact for me to make sure that I could do what is it that I could do. But the reality is that for all of us are resilient. All of us have had negative circumstances that have impacted us, and we've had to survive despite what has come from it. And so, as communities who live in poverty, we still have to fight up against these negative systems, and we still have to work within them. Therefore, our resilience has already been built from previous generations, and they continue to move forward. And so the other part for me around resilience was having mentors in my life. Uh, as I became a senior in high school was when I found that my trajectory became better as my high school principal and high school teacher saw that I was a student that fell through the cracks and wanted to make sure that I graduated. And so it was there that the instillment of saying to me, Amani, you have a future, you have so much ahead of you, and really trying to positively influence me in that way, not just by talking to me, but also providing opportunities for me to thrive was something that was really important. And so I would say that this is the same that our communities have to go through, whether they are impoverished, whether they're dealing with so many different policies and negative procedures that are up against them. We still have to make it work, and it may not always be perfect, but we still try to do the best that we can in spite of the adversity that we're facing.
I just want to, oh, go ahead, Jay, you can go first.
Please, Kat.
I just wanted to say, Amani, I really appreciate you kind of flipping the script a little bit in terms of generational trauma. right? We talk a lot about generational trauma, but I think this is probably the first time I've heard someone talk about generational resilience. And I think that that's awesome, and that, you know, we, as much as we need to understand and appreciate the impact of trauma, I think we also need to appreciate and understand the resilience that, you know, we all have within us. I think that's great. So that's all I'm going to add. As a white woman and someone who hasn't been system involved, I don't want to take up too much space in this question, and I want to leave it to Amani and Jay to answer.
No, that's a great point, Kat, and Amani, you exactly right. The big takeaway here, of course, is, you know, children, youth of color, communities of color are resilient, and it's exactly that, knowing yourself and knowing the individuals around you is how we also get to become more resilient, right? The more we highlight our strengths, the more we unite and have this communal rhythm, the stronger we become. And, you know, in terms of foster care, 1/3 of children entering foster care are of color. One thing that we really do need to start talking about too is, because of COVID and because of the civil unrest and because of a lot of things that are happening, things are compiling, however, right? Children of color, Latino, Latinx, African American, Native American, Indigenous, the reports are coming out, and our community tends to feel more hopeless, more angry, more anxious, more to deal with depression. However, we're also, because of that, because we have so many compiling issues, we are actually more resilient than we think, because here we are, and here you all are, right, in this room right now. And so one of the things good to know is that we are resilient, and there are ways to continue to enhance that and continue to explore that together. And that's one of the things that I'm really looking forward to talking about is, you're already resilient, but how can we really continue to be strength-based and move forward together, co-create together.
Let's dive deeper into that. So we're talking about resilience, and I love that generational resilience, the way that you framed that, Kat, and Amani, the way that you explained that. So let's talk a little bit more deeply about what resilience actually means to you, and what helped you become resilient growing up in foster care, specifically because I know we have people who are participating on the webinar that are actually today working with young people, and it would just be super helpful to know what would be helpful.
Yeah, that's a really good question. I think one of the many things I think about is our protective factors. Each of us have protective factors. And for me, as I mentioned, growing up, you know, I was very fortunate to grow up in a Black household, whether I was in foster care or not. And so the resilience pieces came from, you know, my community. It came from church. It came from my siblings. I was very much, just very much a part of a community that really thrived off of wanting to make sure that we thrived in the midst of the things that we went through. And so I think that for many young people, we all have resilience within us. We just don't always know how to tap into that, how to utilize our strengths in a way that's going to continue to build up our resilience. And it takes people that are walking with us, that are in our shoes, that are sort of guiding us to help us see these things. And so for me, as I mentioned before, you know, growing up with my siblings, you know, I didn't realize at such a young age how important they were for me until I was separated from them. And then that's when you realize that the resilience that you had, that were protective factors that kept you all together, that helped you navigate life in a way that no one else could understand. And when you have those things abruptly removed from you or taken away from you, you don't necessarily know what to do. And so for me, having the ability to still be connected to my church community was something that was really important, as it really helped me to understand deeper parts of who I am. I would say that it's definitely expanded as I've gotten older, more into spirituality, but as a young person, it was really the placing those really important and concrete things into my life and using them as cushions. And so whether that be placed into an after school program where resources were there so that I could eat, so that I wouldn't be hungry when I went home, whether it was a teacher coming alongside of me and saying, you know what, Imani, you may have drawn graffiti on the wall, but we're not going to suspend you. We're not going to expel you. But what we are going to do is you're going to have to, do some community service, and we'll provide you with a job after. But we're also going to stand with you and make sure that you work on your college applications, because even though statistics may have said that you cannot go to college or you may not be able to do this or that, we see that you can do this. And so for me, resilience is about understanding the core parts of who we are, whether that means waking up and brushing our teeth in the morning and that's all we can do. That's resilience, and we have to meet resilience where young people are. Resilience looks different for everyone. And I think that it's important that when we think about and we work with young people and when we do our needs-based assessments and we're trying to understand what creates success, it's really about looking at the young person as an individual versus as a whole entity, because one thing that is resilient for one young person may not be the same for another young person. And so it's really about creating policies, procedures, and practices that have the whole person in mind, starting from internally and then working our way out.
Mani, I love that you thank you for sharing a part of your story, by the way. And I love that you said, your faith, your relationships with your faith community were a big part of your resilience. And I'd love to hear this because for me, it wasn't, but it shows how different we are. And yet we are still resilient and have our own strengths, right? For me, as a teenager, actually, I was kicked out of my church. As a trans individual now, I'm a trans man. That was one thing that I was very fortunate enough as a child. There used to be actually LGBTQ group homes in the United States. It was actually, most of them were in LA County, right? And I was a part of it. It was called GLASS, Gay, Lesbian, Adolescent Social Services. And those group homes are now gone. The reason why I'm saying this is because now for LGBTQ youth, over 30% of them are in foster care, right? They identify as being LGBTQ youth. And yet we no longer have some of these resources. And for me, it actually does, like you, Imani, came back to my relationships from the beginning. My social worker, I was very fortunate to have that relationship with my social worker, as much as we went through our highs and lows. And guess what? Years later, I'm now working with my social worker. We're now working at the Office of Equity for the LGBTQ network, learning network in Los Angeles County. And that's what I mean by building community is definitely important. Resilience for me, the same way. Coming from a very Catholic family, I loved church, loved God, but that was actually it for me. That was also the cause of my suicide attempts for me. It was very negative for me. But again, it goes back to the relationships. My judge, my now mentors, my teachers, all strangers. I grew up with mental health issues in my family. My mother was diagnosed paranoid schizophrenic. My father was in prison. He then came out. It was back and forth. There was a lot of dysfunction. And so that in itself, I didn't know it now. I mean then, but now I know. I always had this curiosity of what was wrong with me. And that led to actually me going into mental health. And guess what? I'm now working for the Department of Mental Health because I realize a lot of us think that there's something wrong with us. And it's my experience working with young people. And it's like, no, that's actually your strength. Your curiosity is your strength. Asking questions is resilience. Those are protective factors. Your curiosity is a protective factor. The things that you might think are wrong with you are actually protective factors and are making you stronger and more resilient. And so let's keep exploring that.
Yeah, I like that you said that, Jay, because I think that especially when you talk about what's wrong with you, there must be something wrong with you. And those things have become your strength. And I think that for so many young people who are under this system and under policies and procedures and all sorts of things, is that we have to begin to also ask questions of what's wrong with the system, because what happens in the system is that they perpetuate what happens, and it becomes a top-down approach. And so for you to have such an appreciation for your social workers and judges and things like that, I find that to be really crucial and important, because it's where selflessness also meets. If social workers and other people are being poured into and are having the resources necessary to really do their jobs well, then that stress can also dissipate to some degree, where the stress becomes less for families. And when we talk about how families who are impoverished and experience neglect, those things that are also on top of their shoulders, it's really difficult to figure out where my strengths are if there are all these policies and procedures that are in place that are saying that, no, that can't be the case. And so I think that it's really about not just asking what makes, young people resilient, but what also makes systems resilient, what also makes social workers resilient, what also makes these different types of collaborations, what means coming together, because the interventions that are in place are there, as we know, have been there, have been structurally there and are racist. And so what do we do to really think through and ask those really difficult questions? Because we already have the resilience within us. It's sometimes the systems that make it difficult for people to always see the resilience that they have.
That was actually the direction I was thinking about. What you all are hitting on is the resilience at the individual level, the resilience at the agency, and then the system level. And I'm just really curious, with you shared a lot about how people who are working within the system right now as caseworkers and clinicians could work to support resilience. You're saying that through your own personal stories, Jay, the support that you received but now is gone. It's different, right? It's evolving. And what that looks like now is important for caseworkers to know. But I'm also curious about what you all think in terms of how can the people in the system, the caseworkers, the clinicians, really advance change at the agency and system level. And I know we have two different perspectives here in the sense that Amani and Jay, you have lived expertise, and Kat works in the system. And so I'd like for us to contrast that a little bit and see, Kat, from your perspective, what do you see? And then Amani and Jay, what do you see from having actually gone through the system?
Thank you. That's a really great question. And I think, Jay and Amani both really touched on how, where the kind of child welfare system in general is a system that is working with people who have experienced trauma, but also a traumatized system. And so, having really kind of making investments in, the vicarious trauma, or, supporting, actually making resources available for frontline workers to do their work and to be able to be kind of present and, resilient in themselves in order to support others. I think the only thing that I would add really is that I think the number one thing is that we need to listen, particularly to the youth and families that we're working with. We need to listen to them, we need to believe them, and then we need to empower them to, be a part of their own, recovery or resilience, as well as empowering them to be a part of changing the system or changing the agency, and changing the direction that we're going in our work.
Yeah, and I wanted to say, for providers, one of the things that immediately comes to mind with my work now is, with the Department of Mental Health, Gita Murthy Consulting. I'm part of Gita Murthy Consulting strike team for the Department of Mental Health. And there's this partnership. What the UCLA Public Partnership for Wellbeing is, it's public university has partnered with the Department of Mental Health, And they are now with the Center of Excellence actually developing trainings, having listening sessions with providers, and with contracted providers, they now have a learning management system out there. If you go to wellbeing, the number 4, la.org, this is an actual resource for the workforce. And it's trainings and it's videos. There's 8 different formats of learning, micro learning sessions. And the reason why I'm bringing this up is because it goes back to also having the discussion, having dialogue, and training, and staying on top of the most updated information, right? That's why research and analysis was part of my job, is important. Staying up to date with what's happening out there. I was just going to start with that, but Amani, please, we can continue on.
Oh yeah, I was just going to add that for me, as someone who has both lived experience and also has worked in the system, one of the things that I can never get away from is thinking about internally how I feel. You know, I work in the field, and because I have had, the background, I always come to it with that personal lens, and I can't, get away from that. And so for me, I often think about, what does it mean for a young person to be in my shoes, or what is it like for me to be in their shoes? What is it like for me to go home and, not necessarily carry the work with me, but I still do as someone who has lived experience? And so one of the things I think about is really challenging organizations to really rethink their internal policies, rethinking how they do their work, looking at the strategies behind their work. Because I think that it's easier to, especially working in a system that has tended to be very punitive, that we can then look at our families in a very punitive manner. And so if we're changing the tide on how things work, especially when we're looking at trauma and how trauma has impacted the brain, we're still doing very early research on the impacts of that. And so we don't necessarily know what that's going to look like 10 years down the line. And so for us as organization leaders, it's important for us to look at our internal policies and our procedures and our culture and how we really do the work. It's about asking and assessing our community, about the young people that are in our care. When we go out and we do, the CPS visits, what are the questions, or what is the assessments that people are using to pull kids out of the home? And I think that if we can start there by looking at our own internal agencies and how we do things, by also looking at best practices, by also encouraging those who are involved in the system to also be a part of the conversation, not after the discussion, but during the discussion, before the discussion, to figure out what it means for them. And so I think it's about really honing in on compassion, empathy, and also, if we're looking at it through an equitable lens, there's different specific practices and strategies that equity uses. And so the child welfare system really needs to move towards that equity lens. The example that I can also give is, my mother has over 8 siblings, and all of them have been to jail because of drugs. But that has not necessarily, does not also determine how good of a parent they're going to be, because we don't do that with white parents. And so it's really about asking, if the goal is to keep the child in the home, if the goal is to have family preservation, then we really have to think about what we're doing to continue to instill resilience in people and in communities, trusting that, they're going to make it happen. Because the thing about it is that Black and brown people have been taking care of their families, and they still are taking care of their families. But because of, the criminal aspect around it, there's so many different things that happen. And so if they're not able to become a foster parent and receive extra funding to help take care of their kids, that adds an extra layer of burden. And so we really have to look at our internal policies to rethink about how we view and think about resilience, not just on the family front, but on the organizational front and the agency front as a whole.
You're you're reminding me, Imani, of a lot of the issues that we see in child welfare related to structural racism and institutional racism. Specifically, one thing that I think about a lot that I know a lot of states are trying to work on is that when, you know, there's kinship family, there's relatives who can be in the lives of young people, but maybe they have some kind of a charge, a criminal charge from 10 years ago. They can't pass the background check, but that was 10 years ago. And it's sort of as if the there's never really a resolution to that continues to carry forward. And there are very resilient relatives and family members who overcome some of that, but at large, that continues to be part of the system that holds it back and ultimately leads to the, you know, it leads to the negative well-being of young people. And I know you're familiar with that a lot, like all those policies. You know, I'm reflecting on some things that you all were saying about organizational culture and how an organization cares for their staff, their employees, their clinicians really does matter. And something came to my mind about how hurt people and healed people can help people. And that was sort of the nugget that I was taking away when you all were talking about that. And I just want to dive in a little bit more into like culture of organizations and talk a little bit about language and attitudes. You know, so let's think about how do the language and attitudes of providers support or challenge resilience in young people? We would talk a little bit more about that.
I think that you know, one of the things that we all need to do, but as professionals in this system as well, is to consistently kind of learn about and reflect on our implicit biases. And you know, that's both in terms of the families or the youth or, you know, the community that we're working with, but also our implicit biases around the systems that we're in and that we're working with. And I think that, you know, in terms of staff or, you know, agencies that are working directly with youth and with families, really kind of encouraging. I think it was Jay earlier that said, you know, really starting from a strengths-based perspective. You know, speaking from a growth mindset, right? That, you know, there are definitely challenges and you know, barriers that are preventing our families or our youth from achieving some of their goals, but you know, we need to add the yet, right? Meeting their goals yet, and that they can do it. And then, and the only other thing that I want to kind of add is, you know, a lot of the work that we do as professionals lives in a document somewhere, right? We have to document everything, and if it's not documented, it didn't really happen, or you know, whatever. And I think we need to really be aware of how we're talking about our kids and families when we're writing things about them, filling out reports about them. You know, if you're working in a child welfare agency, take a minute and go grab a file of a youth and read through it and think about, if you were that youth, how would you feel reading what has been written about you and your family? You know, obviously having that information and being honest is important. But just, you know, I've just personally seen many youth who, you know, when they read through their documents that are in their files, there's not a single thing that's like how awesome this kid is. You know, there's not a single document that's really highlighting the strengths of the youth. It's kind of always document after document of assessment and diagnosis and incidents and, you know, bad things that happen. And, you know, that's, you know, another place where I think we need to be mindful of how we're talking about our youth and our families.
Yeah, and Kat, exactly what that leads to really is what you're talking about is practice, right? And so practice needs to start with a community needs assessment. And I think Imani said it best, right? Go back And some organizations now, and I'm going to speak to LA County because some of the things that we're doing now maybe can speak to all of you out there, because I know it's from different parts of the United States. But some of the things that we have to do is go back to our, contracted providers and say, do you need to review your mission of your organization? Do you need to review your policies and procedures? Are you adding community councils? And some of them are. Some of them are starting to build community councils. There's a new youth advisory board in LA County. It's going to be filled with justice involved and systems involved youth in general, right? Because when you talk about systems, you're talking about foster, and we interact with all of them, right? Foster, unsheltered, justice, and so on. And so what does it look like in practice? And also, what kind of frameworks and models and theories can you use and modify? Because that's another thing we're looking at too. What are some evidence-based practices already working, and how can you kind of modify that to work for your communities? Because one thing we're realizing in LA County, LA is huge, right? It's diverse. Zip code 90814 is different from 90006. And even though that's 2 blocks away, that's going to be a different need. And so it has to be zeroed in to that specific community, even if it means by neighborhood. And I just wanted to say a little bit about that.
Speaking to your point, Jay, as well as Kat, something that came to my mind is, collaboration versus competition. And I think about how many of us have had to sit on group projects, and there was one person pulling their weight over somebody else, and vice versa. And so I think about that in terms of even how we do our work at the organizational front. I find that I currently work in an organization, and we're trying to rebuild our kinship, our kinship care and support, because we recognize how important kinship care is for our young people. And while sitting on a staff meeting, there was another organization that does that work really well. And so I talked about, how can we come together and work together, because there's learning things that we can learn from this organization to help build up our program. And there was a lot of resistance because we're competing with this organization, or we're trying to compete for funding. And so I think that we even have to go back to even how funding has been drawn out, and how funding decides who gets what, and it creates fear-based results where people don't want to work together when the actual goal is to help families and children. And so if we can look at how we can collaborate, and I find that collaboration has been most important, especially for someone who grew up in foster care and someone who grew up with a learning disability. I was always surrounded by a team of people of support that were supporting me in different ways. And so it's being modeled, but there's ways that we can go about it where we're really trying to get back to the purpose, as Jay mentioned, of what is your mission, what is your values? Don't just stick equity, compassion in your vision statement or your mission statement. And then when we talk about equity and how we do that, even down to how we prioritize our meetings, and it's not necessarily being laid out, or it's not necessarily being done. And so again, it's really about having to challenge our internal processes and procedures, because a lot of what gets inputted starts from like how you output things. And so I just really think that collaboration is really key, because you can get a lot done with more heads at the table than just trying to do it by yourself. And again, recognizing that young people and families are at the tip of that.
And also, how can you have an intergenerational approach with young people? That's another thing we don't really talk about, right? It's helping communities, helping each other, intergenerational approach.
I agree. That's so important. And I think just to even turn back around and talk about, like I said, with all of my mother's siblings have been to jail. And all of them have been clean for more than 20 years too. And to me, that's also intergenerational. That's doing the work-ins. And now my aunt is caring for my cousin whose mom passed away, and the work that she was able to do, not just with NA, but AA, and also the community that she has around her is helping her do that work really well. And so it's about understanding that, you know, people just don't do things because there's often a reason, and it usually stems back to trauma. And so if we're able to meet people in their trauma, we're definitely able to meet them at that intergenerational point, because that's where trauma started.
You know, you're starting to go into the direction, Amani, you must be reading my mind, that I wanted us to go in. I think the points that you all are making are spot on. And I just want to quickly point out that in the chat, you're getting a lot of love from the people in the audience, and appreciation for sharing your story. And obviously you're sharing your story because you want it to impact people in the way that they work and show up in their roles. And so lots of love and appreciation for that. And there's also a question in the chat that relates to the direction I was moving in. Someone wrote in the chat about many of the youth talk about feeling like people don't take their trauma seriously, or do not work with them to ask them and have them identify what it is they need. And so, you know, we know that so many young people in foster care are trauma survivors. And, you know, what does resilience mean for young people who have experienced trauma? And, you know, the question in the chat really is about how should we better engage youth around this conversation and topic? So if you could talk about that, I think that'd be very helpful.
I think about engaging with ourselves, because the thing about trauma is that it's typically a process. You know, trauma just didn't show up, it took time. And so just as much as trauma showed up, we have to understand and recognize that healing also takes time. And I like to think about it as a lifelong journey. And so that's a really good question, because, you know, I think about myself as, you know, someone who was diagnosed with PTSD, major depression, and panic anxiety at the age of 20. And thankfully, I was with a psychiatrist who really helped me navigate that process. And I was able to get the support that I needed. But I didn't anticipate that in 2016 that I would lose my sister to suicide. And all of the things that I worked really, really hard to continue to do sort of all of a sudden crushed and crumbled. It felt like my world had completely stopped and the world kept going. And so I had to really try to understand what did it mean to really rehash and to go through my trauma and my grief. And one of the things that I realized is that the world is not always empathetic towards that, because we live in this frame of, you know what, it happened, so you just should just get over it and keep going and move on with life. But that's not the way that life always occurs. And so young people who are in care who've experienced trauma, traumatized kids also become traumatized adults. And so the thing about it is that it's about meeting young people where they are. And what Kat said earlier, it's really about listening to their stories and listening to the things that they've gone through. It can be a ripple effect. It's triggers. It's not that you might just be experiencing that trauma. You might be out of that trauma, but it doesn't mean that you're not experiencing the impacts of that experience. And so we're still dealing with the effects of 9/11. We're still dealing with the effects of all certain atrocities that have happened across our world. We're still dealing with the atrocities of slavery. We're dealing with the impacts of that, as well as Indigenous people and Latinx people as well. And so for me, we wouldn't necessarily tell somebody who was physically disabled, you know what, get up and walk. We wouldn't do that. And so why would we do that same thing to people when it has happened internally? And I think part of it is because we haven't quite understood all of what trauma has done in the mind and the brain and the impacts of that. And so as a society, we're hard on ourselves. Therefore, we're going to be hard on the people that we're with. And that stems to happen with our young people. And it's not just about, okay, go to college and do this and do that, and you'll be okay, because I've done all that. And I still experience the effects and impacts of my trauma. And I think that that should be okay. For me, it's about, how do I live with it? How do I still maneuver through it? How do I have people in my corner to say, you know what, Imani, today, you know, your sister's anniversary is today. Why don't you take the day off? Why don't you take some time to do something for yourself? And luckily, I had a supervisor like that that really was with me through that process. And part of it was because she had experienced a loss of her sister when she was my age. And she said that nobody was there for her. And she wanted to provide that for me. And so we can provide that for our young people, again, from our own experiences or the experiences that we haven't had, but we know that others have had, and really trying to implement those for our young people. Because as much as people are resilient people also get tired. And we have to recognize that being tired is okay.
I think I just want to kind of piggyback on what you were saying about kind of revisiting trauma, or how it, you know, comes up again and it isn't necessarily like, you know, the event happened and it's over. I think, you know, it's helpful too when we're thinking about particularly foster parents or adoptive parents who are caring for a child who's experienced trauma, to really have an education and understanding of the impacts of trauma on development. And that, you know, I think, you know, sometimes there's kind of a thinking of, you know, well, the trauma happened when they were so young, so they don't remember it. But we know that, you know, you just don't have the words for it, but your body remembers it. And that, you know, trauma and kind of working through it and the recovery from it happens multiple times in the lifetime. And so you may have a young child who seems to be doing really well, and then, you know, adolescence hits. And, you know, now there's kind of a whole new series of events and kind of development that needs to happen. And part of that too is kind of figuring out, you know, living with this trauma, and what does resiliency look like now that I'm in this stage of my life. And, you know, I think really kind of having that understanding that even getting support services, getting counseling, or, you know, whatever it may be, isn't like you're going to fix this person now, right? Like, oh, just fix them. I'll come for like, you know, 6-week sessions and then we'll be great and everything will be better, right? It's really about, you know, it's a lifelong, resiliency is a lifelong journey. And you're going to have your ups and downs, and, you know, needing that support system around you that understands those ups and downs and is kind of there for you, you know, whether you're at a peak or at a low. I think the only other thing that I would add that's really important is also helping youth who have been systems involved, particularly if they've been in care for quite a while, really helping them understand and clarify their story. Because I think, you know, bad things maybe have happened in their lives and have happened to them. And without really having that ability to work through all of it and kind of clarify what happened and have a clear understanding, you know, it's easy for youth to come up with stories in their head about what actually happened. How was this my fault, right? What did I do wrong? And so, you know, being able to help youth understand and integrate their life story, you know, in order to help with the processing of that trauma, and with kind of seeing where all the pieces of their life kind of fit in the future as well.
For the individual that asked that question, I want to say there are some, if you want to get also more evidence-based as well and actually talk about what it's called, motivational interviewing is a great thing to use when speaking and engaging with youth. But I got to tell you that the key thing to continue and having a successful, I think, just relationship overall in general, right, is authenticity. It's just being authentic with your youth, knowing your own limitations. And then also when you engage with the youth that you're working with, they actually, one thing I've learned that I also experienced myself is I never knew about emotional regulation. I never knew about emotions, feelings, needs, and matching that. And so one of the things I personally do and work with youth is we actually, if you check out the college essay guy, he has his own YouTube. It's called the College Essay Guy. He actually created this sheet, and it's kind of like the feeling wheel, but you have your feelings on one side, and every major feeling, right, has sub feelings. And then you have a need side. And so it's good to also talk about feelings. And believe it or not, that's how you get to talk about the story. And the thing about systems involved youth, one thing to remember is that the minute somebody's been in the system, it will be forever there for the rest of their lives. And so now it's more about navigating situations with that experience. And so to the individual that asked that, really again, authentic engagement, empathic listening, and if you look at whatever state you're in, and, you know, for us in California, there's a California Behavioral Institute that has come up with many different new ways to have telehealth visits, to have engagement, to learn more about these skills working with youth and families. I would say look up also in your state. There are many different resources being put out there, many different studies being done, evidence-based practices for you to use with your youth. But again, one thing I can honestly say again is authenticity, knowing what you're feeling, and then also what are you learning just in general. And also remembering that not everybody is going to like that word trauma. It's not going to resonate with people. And so that's another thing to also remember, right? Is knowing how they want to narrate their own story, and if they actually even want to focus on their story. But that's just what I'm saying.
Jay, that is a great point. You know, a lot of the young people that we work with across the country say to see me for more than my trauma, see me for the resilience that I hold and the fact that I can heal. And so that's just very powerful that you would share that. It's hard to believe, but we are almost out of time. Time has been flying by us, and as we start to wrap up a little bit, I wanted to give each one of you a chance to just share one key takeaway for the group about this whole conversation.
Listen, my key takeaway is lead with love, lead with passion. Lead with love, lead with passion. And the more we know each other, like the more we know ourselves, the more we also can help other people highlight and know who they are. And then we can start co-creating together.
I would say, and that's hard to follow, Jay, thanks. I think one of the key takeaways for me is just the importance of connections and importance of, you know, support and, you know, having people around you that can be a support, that can, you know, check in on you, that can remind you of how resilient you are when you need that reminder. Is, I think, super important.
Yeah, one of the things that I'm thinking about is, you know, through our experiences, through our traumas, through very difficult situations that we've experienced, it's sometimes difficult to see us as whole beings. And going back to the start of who we are, and I know that for many of us, our starts were not always as whole as we would have wanted. It doesn't take away that we are still whole beings. We just have had things that have happened to us that have made indents and imprints into us. And so leading with knowing that we are whole beings, that we have worth, dignity, and value, despite the things that we have gone through. and that those things and those experiences that we may not have known to be things that were going to get us to where we are, such as having a voice after experiencing something so traumatic, is knowing that the resilience that you have within you has been born within you and is going to continue to grow. It's going to continue to develop with the people that are on your side and also with the community of people that you're with. And so just recognizing that healing is a lifelong journey takes the pressure off of us to not always have the correct answers, but to know that we have, like what Jay said, that we have the passion to continue to do the work, that we have the empathy to do the work, that if we continue to see ourselves as whole, we'll begin to continue to make this a better place. So I just want to thank you all for having me. It's been amazing, and to all of you who I've been on the panel with.
Amani, I think you all hit great key takeaways. Lead with love. I love that. That's something that's not clinical, but that we could just add so much more of in all the work that we do. Leading with love would just make the world go round. I'm with you on that, Jay. Holding your connections, Kat. Thank you for reminding us of that, how important connections are to remind us of our resilience, of the hope and the promise. And to Amani's point, seeing us as whole beings, seeing young people as whole and not broken, but whole, and seeing ourselves as whole. Great reminders, great takeaways. We are so thankful to the three of you for sharing your hearts and your souls and your knowledge and your expertise. And I just want to remind everybody in the audience that we will make the recording of today's event available on the MHTTC website. We're also going to send a follow-up email with resources related to this topic and a survey that we hope you will complete to let us know what you thought of today's event. You'll also receive information on how you can request your certificate of completion for those of you seeking CEUs. And I would just remind everybody to please visit the MHTTC website at mhttcnetwork.org just to learn about other upcoming events and trainings and to access the library of products and resources. Again, thank you everyone and enjoy the rest of your day. Take care.